recognizes the gentlelady from Tennessee, Mrs. Blackburn, for 5 minutes.
Thank you, Mr. Speaker. I come to the floor this morning to talk about a piece of legislation that is going to be before us this week. And we're bringing it forward through the Congressional Review Act. And in our office, we've had so many people say, what is a Congressional Review Act and how is it that you can recall these rules? This allows Congress to exercise their authority over the agencies and the administration and the executive branch interaction where they make rules. And many times they do these rules, as this previous administration did, at the last minute, as they're heading out the door, trying to put their thumb and their imprint on actions and prohibit Congress or prohibit the states from taking an action. So as we meet in this chamber this week, we're going to take up H.R. 43. And H.J.R. 43 is a resolution which will disapprove of one of these last-minute rule changes that President Obama made as he was exiting his office. This one deals with Title X funds and the grant allocations that come through Title X funds. Now, Title X funds were put in place to serve women and their health care needs, underserved women in underserved areas, and to make certain that there were provisions so that they could access women's health and have access to preventive screenings, to annual immunizations, those checkups that they need to have each year. And many times these funds have been used by individuals who will say, we do women's health and we also do abortion services. Now, what this bill, what the rule would have done was to block the states and to take away their ability to go in and say, who is going to have access to these funds, and are we going to disallow them to go to entities that provide abortion services? So H.J. Res. 43 repeals the previous administration's rule, and it restores and gives back to the states the flexibility that they want and desire to have to distribute these Title X grants under the parameters for which this program was designed. States should be able to offer family planning funds to providers that offer a full range, a complete range of health care services for women, but do not participate in elective abortions. Title X funds outside of the Affordable Care Act were intended to help keep patients healthy and to help them on the road to a better quality of life and better health outcomes, not to take away life. H.J. Res. 43 also redirects Title X grant funds to other clinics comprised of local health departments, hospitals, and federally qualified health clinics that seek to protect life and offer health care services to women. Mr. Speaker, I ask my colleagues to support H.J. Res. 43, which repeals the previous administrative efforts which undermine the state laws and restore to the states the Title X grant program for its original purpose. And I yield back.
Gentlelady yields back her time. Pursuant to Clause 12A of Rule 1, the Chair declares the House in